Day 2 of the mHealthSummit began with Ted Turner, chairman of the UN Foundation and one of the most influential philanthropists in the U.S.
And a lot of incredible work is being done, and I would like to congratulate the people in this room for all your efforts that are going into making the world better and making it a healthier, gentler world.
Turner has been championing programs to improve air, water quality, climate, safeguarding environmental health, and developing practices and policies to curb population growth rates.
Right now, I'm trying to cover wind power. Wind power has its own weekly magazine, like Cablevision did. Just keeping up with wind power alone. Then there's solar power, then there's geothermal, then there's tides. Then there's biofuels, and there's ethanol. I mean, they're just keeping up with the alternative energy business is more than one person can do.
Please join me in welcoming Mr. Bill Gates.
Highlights of the afternoon were led by a keynote luncheon with Bill Gates, who spoke on how mobile phones could potentially save millions of children's lives in developing countries.
When we look at something like maternal mortality, there's a certain level you can't get below if you can't do C-sections. And doing a C-section requires a sterile environment, a certain amount of expertise, and yet in some ways it's fairly routine. And so if you could have a robot that can do that, that's fairly inexpensive, that's a great thing.
That's emerging from the private sector.
Another important speaker in today's lineup was Anish Chopra, U.S. Chief Technology Officer for the White House, who expressed the Obama administration's commitment to this initiative.
Cell phones are a tremendous platform for innovation, perhaps even more so than the traditional computer, number one. Number two, the need in this environment is to bring academics, the private sector, the nonprofit community, and the government together to think about ways in which we can collaborate and unlock some of the barriers and to find ways to introduce new products and services that we haven't even imagined yet. And so number two, the summit is very helpful to bring those folks together. And three, this president is very committed to engaging in a way that will deliver leveraging technology for lowering costs, improving quality, and frankly, improving the customer experience in our nation's healthcare system with implications for the world.
And texting is one of the mobile applications currently being utilized as a tool to improve maternal health and to reduce child mortality.
But Text for Baby has a track record of being bold.
During a press conference, the National Healthy Mothers and Healthy Babies Coalition announced the plans to reach millions of moms in the U.S. through a mobile phone initiative made possible by a multi-million-dollar commitment from Johnson & Johnson.
We've been in the baby business for a long time. We love babies, we love mothers, and we love healthy babies and healthy mothers. So when we heard about Text for Baby and the concept of marrying mobile technology, right, with providing the most needy in the country, and in fact now around the world, the ability to get health information, to have healthier pregnancies, to have healthier births and healthier babies, that sounded like a great idea, and we wanted to get behind that.
And this program hopes to improve maternal health and child mortality in the U.S. and in the near future in the developing countries. Mildred Espinosa, South South News, Washington, D.C.